Can I get Juvederm filler and acne laser scar removal at the same time? So I plan on getting acne laser scar removal and Juvederm filler in my smile lines and lips, but not sure if you can do these things in the same day. Should I do one at a time? If I can do these procedures in the same day, does it matter which one I do first? Thanks.
Thank you for your question. You're asking if you can get Juvederm fillers and acne scar laser treatment at the same visit. And in the substance of your question, you are stating that you want to have the Juvederm for smile lines and for your lips, and that you want to have a laser done at the same time. And would there be any issue, or should you do one before the other? Well, I can give you some guidance with this question. This is in absence of a photo, but I can give you some general rules of thumb as to how I approach patients like yourself with this type of issue. So, just a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have been performing laser for cosmetic procedures since the mid-90s with the original CO2 lasers. In my practice, we have multiple lasers for the treatment of acne, including CO2 laser, erbium laser, Nd:YAG lasers. And so we certainly have a lot of technology and experience with the treatment of acne scars. Of course, as well, I've been using fillers since the beginning when collagen was the original filler, like Zyderm Zyplast. So I think the essence of this question really is based on the degree of your acne scars and what level of laser treatment you're going to undergo. So let me explain that further. Having a filler like Juvederm placed in areas where you're not treating with the laser is certainly reasonable. When I perform procedures in my practice such as facelifting surgery, eyelid surgery, it's not unusual to do fillers at the same time. It's just a matter of planning things out in a way that makes sense. However, if you're planning to have a very extensive laser procedure, well, that means that you're going to be resurfacing or treating a large area, and you may not enjoy the benefits of your filler for a certain amount of time to allow for healing from the laser. Now, if the acne laser treatment is something like a fractional laser treatment, and we do this in our practice, we have a fractional erbium laser that we use for acne scars. In that respect, this is something that's kind of an episodic treatment separated by several weeks to allow for healing, but it's fractionated, which means there's less downtime, and we're able to allow the healing process to occur a little faster, and it's less disruptive to a person's life and schedule. And a lot of times in the strategy of treating acne, we use platelet-rich plasma. We also do use fillers, particularly for rolling acne scars. There is a lot of ways to help people with acne. You can do microneedling. Basically, I'm giving you some ideas of why there is no right or wrong answer just based on the question, but I think that if you want to use a certain guidance, just think if there is going to be any significant downtime with the planned laser. If there isn't, then it's certainly fine to do the injectables at the same time and save yourself a little bit of time, and then come back for further treatments as is appropriate. So I think that you have to speak to your doctor about the details of the type of acne acne laser procedure that you're going to have. If you haven't done that as of yet, well, then this is an opportunity for you to get opinions, because when it comes to treating acne scars, you're going to get a lot of opinions. Everything from subcision, from microneedling, platelet-rich plasma injection, lasers of different kinds, and with different strategies. And acne treatment, acne surgery as well, in addition to that, all of this is to try to maximize the blending of the scars as well as to maximize the overall quality of the skin, so that the areas where there's the most shadowing from the acne and the most obvious pits and areas that are undesirable improve. And so certainly for the purpose of smile lines, which are more of a just normal skin changes and the improvement of lips, those things are usually not involved unless the acne scars in the cheek area overlap with the smile lines. So I think it's important that you meet with qualified experienced specialists if you haven't already done that. If you have, again, discuss these issues with your doctor and get realistic understanding of what your downtime will be with the acne scar treatment. So I hope that was helpful. I wish you the best of luck. Thank you for your question.